Hello. I am Norethindrone Acetate. My brand names are Primolotnor, Angistin, Gistacadin, Miligainon, Monogest, Norlotate, SH420, Sovel, and Streptin. And I am Category X.
Hi everyone! Nalilito ka, no? Well, you should not. I am still the same. I am still Norethindrone Acetate. Pero sa ibang pagkatao lang. Well, anyways, I already assume you already know my generic name, my brand names here in the Philippines, and my chemical name. Also, don't forget my pregnancy category. So now, let's proceed to my drug classification, to my therapeutic one, and my pharmacologic. So, for my therapeutic one, I am a contraceptive. Again, I am a contraceptive. And for my pharmacologic one, I am progestin or progesterone. Anyways, let's proceed to my mechanism of actions. I know some of you are asking on how I work on a human's body. Well, without further ado, I will answer it. On a molecular level, progestins like me exert their effects on target cells via binding to the progesterone receptors that results in downstream changes to the target genes. Contraceptive efficacy is derived mainly from changes to the cervical mucus wherein I increases the cell viscosity and content of the mucus to prevent the impaired sperm transport and migration. I also induce changes to the endometrium, including atrophy, irregular secretion, and suppressed proliferation that make it inhospitable for implantation. Working via negative feedback loop, I also acts on the hypothalamus and anterior pituitary that helps to suppress the release of follicle stimulating hormone or the FHS and luteinizing hormone which is the LH from the anterior pituitary.
And I am readily absorbed from GI tract with maximum plasma concentration generally occurring at about 2 hours post-dose. My distribution volume is 4 liters per kilogram and my 36% binds to sex hormones binding globulin or SHBG and the rest 61% binds to albumin and I undergo with an extensive biotransformation via reduction followed by sulfates and glucuronide conjugation. And my plasma clearance value is zero point 0.4 liters per hour per kilogram. And my half-life as following a single dose administration is 9 hours.
So for my indication, I am indicated as an oral contraceptive when given as monotherapy or in combination with an estrogen component such as ethinyl estradiol. Combination with an estrogen component, I also indicated as an hormone replacement therapy for the treatment of postmenopausal osteoporosis and moderate to severe vasomotor systems arising from menopause. Also, when applied via transdermal patch, the combination of me and estradiol is indicated for the treatment of hypoestrogenism, vulvovaginal atrophy, and moderate to severe vasomotor symptoms. If I also taken in combination with the intramuscular leufolide, that I am also indicated for the symptomatic treatment for endometriosis related pain.
I am dangerous to those patients with vaginal cancer, undiagnosed with vaginal bleeding, impaired liver function or hepatic disease, malignant liver tumors, current or recent thromboembolic disorders, and active DVT. And I am cautiously used to patients with diabetes, seizures, migraines, cardiac or renal disease, asthma, and depression.
So now, let's discuss my side and adverse effects. My side and adverse effects. I can harm. Ah. Anyways, so For the central nervous system, I can cause depression. For the cardiovascular, I can cause edema and thromboembolism. For the eye, ear, nose, and throat, I can cause exophthalmos, diplopia, and retinal thrombosis. For the genitourinary, I can cause breakthrough bleeding, dysmenorrhea, amenorrhea, cervical erosion, and abnormal secretion. For the hepatic, I can cause cholestatic jaundice. For the metabolic, I can change the weight of a person. For the respiratory, I can cause pulmonary embolism. For the skin, I can cause melasma, rashes, acne, and pruritus. And for the females, I can cause breast tenderness, breast enlargement, or breast secretion.
And before giving me, the nurse must check first the blood pressure of the patient. The nurse should give me to the patient every day at the same time cautiously with no interruption between pill packs when used as contraceptive. The nurse should know that I should be given to the patient without regards to meals because I may cause GI upset. This um and they must first assess for my contraindications before administering me. The nurse should know that if the patient vomits soon after taking me, he or she must advise the patient to use a backup method of birth control for 48 hours. And the nurse should advise the patient to report any unusual symptoms upon using me as contraceptive.